Assalamu alaikum warahmatullahi wabarakatuh, everyone. I'm not being introduced tonight. I was told that I could just start. Um, so the topic that we're talking about tonight is quite an important one, I think, and I was very glad that I was asked to speak about this. It's actually a topic that colleagues and I speak about quite often, out of a place of concern, because oftentimes people are seeking help, psychological help and counseling, and there are a lot of people around. And some of our concern is around the fact that the public might not actually be getting exactly what they think they are. So, inshallah, I will be talking about the different kinds of mental health professionals and how to be careful and discerning in knowing who is actually, qualified for what, because the risk that one runs is that you're in a vulnerable situation and you are needing support, and the last thing you want to be worrying about is whether or not somebody's qualified enough and whether or not you are in good hands. Okay, so let me get my slides up here. I don't know why. Hopefully it'll come on in a second. Oh, my connection's unstable. Sorry about that. Okay. So it's the title of the presentation is How to Seek Psychological Support as a Muslim. I will be talking about that, but to begin with, I was also asked to cover a bit of info that often needs to come before that. And as I said about, trying to, as someone who's not in the mental health profession, how to navigate everything that's out there and know who is actually who and what you're needing and what you might be getting or might not be getting. All right, so in terms of the overview of this presentation, I'll be talking about the types of therapeutic modalities, the differences between mental health professionals in South Africa, how to choose which type of mental health professional to see, where to find mental health professionals, the pros and cons of free and low cost options, and do I have to see a Muslim mental health professional? Or we can think of it as Muslim versus non-Muslim mental health professionals, and what are some of the things to consider there. So in terms of this term, therapeutic modalities, it basically means the different kinds of therapeutic frameworks, so psychological theories that inform different kinds of therapies, and all therapies are therapeutic modalities, kinds of therapies within psychology we're talking about now is helpful. In fact, research what is the most predictive of how helpful or not therapy will be is actually the relationship between a client and a therapist. So it doesn't actually matter what therapeutic modality you use, but sometimes it's useful to know. Okay, let's just see. Sounds a little soft. My volume's on max. Okay, guys, I am going to just let me know if this is better. I'll bring the speakers a bit closer. I don't know if that helps. Hope it does. Tell me if it's still soft, okay? Anybody can just tell me. Right. So let me know if you can hear. Okay. So about the different kinds of therapeutic modalities, the one is psychoanalytic, psychodynamic therapies. So this is probably what you're more familiar with in terms of movies, right? Someone's lying on the couch and it comes from Freud and some of his crazy ideas. Some of it wasn't so great, I will admit. And there has been a lot of moving on from there. So, okay, the message, maybe I'm still soft. Better, thanks. Okay, great. Okay. So I've moved my speakers closer and hopefully that helps. All right. So the focus in psychoanalytic and psychodynamic therapies is changing problematic behaviors, feelings, as well as thoughts, right? So the way in which therapists often do this is through helping the client to uncover unconscious roots of the symptoms. So the idea in psychoanalysis and psychodynamic therapies is that a lot of what is happening with us, we're not entirely aware of why, right? So it helps. So it helps to understand those unconscious roots, as well as help you to apply this understanding to your life. And this is done through analyzing the impact of life events, significant life events, also analyzing the impact of, analyzing desires and past and current relationships, and the impact of that on a person's feelings and choices they make because of them. So to give you a little bit of info on that. So oftentimes whether our parents got divorced or not, or whether they had a good marriage or not, oftentimes, not oftentimes, always, our relationships with our parents will, as well as siblings or other significant people in our life growing up, a lot of that will impact our choices that we make now, but also our relationships that we have now. And so, as I said, so it looks at how all of these factors impact your feelings and choices that you make, right? And these choices, the idea in psychoanalysis and psychodynamic therapies is that these choices are often compromises that the person has made to defend themselves against painful thoughts or emotions. So again, this idea that there's a less conscious part of us that almost makes decisions for us to protect us. So for example, and the example given here, a failed relationship, right? That was painful, and it may make a person believe that all relationships will be painful. And so they may seclude themselves because of such beliefs and keep struggling with this fear of either being cheated on or hurt. And what the person might consciously say is something like, no, I'm fine on my own, and who needs a partner anyway, and things like that. And that's probably what they really think they believe. But underneath that are fears around getting hurt again. And this is what drives the behavior. So psychodynamic therapy helps the individual to overcome their fears and make better choices for themselves. So that your choices are intentional, that your choices are better for you actually, and you want to operate from a place of what you are aware is good for you and not from a place of fear. So this kind of therapy may be short-term or long-term. It may focus broadly on things or more narrowly on a particular issue or symptom. It focuses on the person's interaction with the people around them in order to help them better understand their needs in a relationship, as well as healthy and unhealthy ways of meeting those needs and what they can do to improve their ability to express or communicate. So in looking in therapy at someone's relationships, often also the relationship between the client and the therapist, because the therapist can tell a lot from somebody just by the quality of their relationship. By looking at that, we help clients better understand their needs in a relationship. Because oftentimes we might think we don't have this need or that, but actually we do. And so we might put, no, I don't need that kind of attention or things like that. But then we come to realize you get quite passive aggressive in relationships. And this is not a healthy way of getting those needs met, because actually it probably pushes your partner away. And then what is spoken about is after you've acknowledged that you actually do have certain needs, how to better increase the chances of you getting your emotional needs met in a relationship. So that's the first major kind of therapeutic modality. So therapy based on psychoanalytic and psychodynamic therapies. Theory. See, Daisy, my thing is going too fast. Let me just go back. All right. So then the next broad kind of therapeutic modality are behavioral therapies. And the principle behind these therapies are that um, uh, all types of behaviors are learned, and unhealthy or harmful behaviors can be changed. So the focus is a lot on behaviors here, as opposed to the previous modality I mentioned. And so what happens in these kinds of therapies is that you explore the reasons behind the development of both normal and abnormal behaviors in a person. And within behavioral therapy, the approaches could include cognitive behavioral therapy, where the focus is on changing the thoughts and beliefs that are causing problems with someone's mood or actions. So there'll be a lot of, you know, not clarifying, sorry, determining and ascertaining, okay, what actually are the thoughts and beliefs behind your behaviors. And so there's a lot of homework given, and a lot of self-awareness is created in this process. Aversion therapy is one where also a kind of behavioral therapy. This involves teaching the person to associate a desirable but unhealthy stimulus with an extremely unpleasant stimulus. For example, the person may associate alcohol or drug use with an unpleasant memory. And in this way, with that example, what is being the objective here is to try and actually help with the cessation, the stopping of alcohol and drug use, and an unpleasant memory is associated with that to help the person not have this kind of positive association and not want to go towards this thing that they actually want to stop. Then systematic desensitization is a kind of behavioral therapy that's used with phobias to help people overcome phobias. So if it is a phobia of snakes, for example, systematically starting perhaps with a picture of a snake and moving to the top of the log, which might be touching a snake, one is exposed systematically over time, and it's paired up with relaxation techniques so that you can eventually begin to tolerate the thing that you need to. Snakes might not be such a problem, but perhaps the fear is around public speaking or taking a lift or something like that, and you can't really avoid that in your life. I mean, like an elevator lift, then one would probably need to engage such a therapy. Then there's cognitive therapy, and as the name implies, the focus is on cognition, so what you think rather than your actions, what you do, your behaviors, as in the previous one. The principle here is that harmful or dysfunctional thinking leads to dysfunctional emotions or behaviors. And so here, the idea is to change the person, to change the way they feel and what they do. Then humanistic therapy, and okay, I'll get to that later, but humanistic therapy is one that focuses on valuing a person's capacity to make rational choices and developing their maximum potential. Over here, it is emphasized your respect and concern for others. This is known as a client-centered approach, which results in as the name implies, centering the client and not viewing the therapist as this authority who knows exactly what's going on with you, can tell you exactly what's happening with you. And you might think, but surely that's the point. You go to some kind of professional and you almost want them to tell you what's going on with you. But what's really empowering is actually to understand that you and your therapist can co-create and understand what's happening with you, because ideally you want to, in some ways, become your own therapist eventually, where you can ascertain these things for yourself. So this is seen as a partnership where the therapist helps the client to change by emphasizing the concern, care, and interest. So that's another element of it, where not to say that therapists who use the other modalities don't care or have concern and interest, but it is emphasized in this kind of therapy because, the idea is that a lot of hurt in our lives happens in relationship, and so healing should happen in relationship, where you feel that kind of care and interest. And about these modalities, usually, so universities will usually have a leaning towards maybe the psychologists get trained in a more psychodynamic way or more cognitive behavioral therapy way. But these can be combined because we usually are trained in all of them, but maybe not all psychologists are trained as much in a certain modality than others. But oftentimes they are combined and elements are used from different approaches. But of course, you have to be trained in all. You can't, yeah. And we'll get to that later about the importance of being properly trained. Okay, so this just ignore, I couldn't get that out there, guys, but just ignore that on the slide. So then I was also asked to talk about the differences between the types of mental health professionals in South Africa. So the Health Professions Council of South Africa is a governing body that governs all health professionals. So these include psychologists and counselors, but medical doctors or, occupational therapists, physiotherapists, all of them. And according to the Health Professions Council of South Africa, there are a couple of categories of mental health professionals. This doesn't include all the psychologists that are included by the Health Professions Council of South Africa, also known as the HPCSA. But I'm going to talk about the ones that you would most likely encounter when you are looking for counseling with therapists, right? So the first is a clinical psychologist, and these are people who work with individuals, couples, families, and groups. They're very broadly trained, and they aim to optimize a client's psychological well-being through intervening in life challenges and developmental problems. They provide comprehensive biopsychosocial healthcare across the lifespan. They're able to assess, diagnose, evaluate, and treat mild to severe and complex psychological problems. For example, depression, generalized anxiety disorder, eating disorders, schizophrenia, and bipolar mood disorder. And why they're able to do as much as this is because of the very rigorous training process one has. There's a 3 years bachelor's degree, majoring in psychology. There's a 1-year honors degree, specializing in psychology. There's a 1 to 2 year master's degree in clinical psychology. There is a 1-year internship, and it needs to be at a psychiatric hospital. And this is where, a lot of the skills that are needed to be able to treat and diagnose mental disorders are received. And a 1-year community service, and then a board exam that gets written. Then one gets counseling psychologists, and this is very similar to clinical psychologists. One of the biggest differences is that they are not able to diagnose and treat severe mental illnesses. And so the qualification process is very similar, but it would not include the internship at a psychiatric hospital. But as with a clinical psychologist, they're able to work with individuals, couples, families, and groups. Both clinical psychologists and counseling psychologists, usually you are able to claim from medical aids. Definitely with a clinical psychologist, the counseling psychologist, and some medical aids are a bit, medical aids, but they're a bit iffy about that. But by and large, they would pay, as far as I know. Then you get educational psychologists. This registered counselor category is supposed to be in the same kind of indent as the educational psychologist. So that's not underneath educational psychologist. But anyway, firstly, the educational psychologist. So that is a psychologist who is, they focus on children experiencing educational difficulties, and they often work in an advisory capacity to the child's teachers as well as parents in terms of the child's educational capacity and difficulties and needs and the kind of educational environment that would be helpful for the child. Clinical psychologists are also able to do these kinds of psychoeducational assessments. Educational psychologists are usually better placed at doing so. Registered counselors, as I said, it's actually another category. I didn't mean to indent it like that. A registered counselor is somebody who has done the 3 years psychology bachelor degree, the honors degree of a year, an internship of 6 months, and a board exam. And that allows them to be registered under this category. It's a registration category called registered counselor. And what they're able to do is they are able to assist clients to optimize their personal functioning by focusing on supportive, developmental, and preventative psychological interventions. When it comes to mental illness, at this point, registered counselors have to refer on to counseling psychologists, or with severe mental illness, clinical psychologists. Just to clarify, a clinical psychologist is not only for severe mental illness. You are able to treat across the board. So I'm a clinical psychologist and I'm in private practice, which means because I'm not in a psychiatric hospital, I very rarely see severely mentally ill people. It is often people who are struggling with life, things, divorce, death, and probably from those things resultant, anxiety and depression. Or could be stuff from childhood that they haven't realized that affects them as adults. And so it's not that clinical psychologists only see the severe mental illness, but that they can see clients across the board. Yeah. Then psychometrists are people who do psychological assessments, and they measure and assess different domains of functioning and that contribute to the development of psychological tests and procedures. So they can test for a lot of scholastic functioning. They aren't educational psychologists, though, so the ability to advise in terms of interpreting the results in order to advise what kind of educational environment the child would be best placed in is often less. They're often less able to do that as an compared to an educational psychologist. They also are found in doing assessments for companies, private companies, or universities, government departments, and private practice. So the focus is largely on the testing of various domains of functioning and assessing that. Then a clinical social worker, so they are not psychologists, but they provide a really important service. They are registered social workers, and they specialize in therapeutic competence to intervene in the mental health and other psychosocial consequences of psychiatric health and other life challenges. So oftentimes clinical social workers are really experienced in working with families. They often have been working in a setting of whether it is in a setting with other psychologists and psychiatrists, and as opposed to a statutory social worker, these are more the experience and allows them to conduct therapy more. Again, they would have limitations as a result of their not having experience with severe mental illnesses and that sort of thing. So in terms of how one chooses the correct type of mental health professional, this is largely determined by what your needs are. It can be hard to know sometimes what your needs are, but for the purposes of counseling, clinical and counseling psychologists and registered counselors are usually used. So there are other kinds of psychologists. There are research psychologists, neuropsychologists, and that sort of thing. But those are the ones that you'd go to for counseling of some sort. Clinical psychologists can be consulted for any and all psychological difficulties, as I said. counseling psychologists are not as experienced, as I mentioned before, and competent in diagnosing more severe psychopathology. And registered counselors are not qualified to diagnose any psychological disorders and are therefore also not best placed to treat those with diagnoses. The treatment of people with psychological difficulties is really, it's really important that you get the right kind of help, because those are not things to be messed with, and it can have negative consequences if you don't have somebody who is able to help in that way. Okay, yes. So this leads into the next slide and what I wanted to speak about, which is the risks of seeing an individual who isn't sufficiently qualified. So the problem with this is that an individual who isn't sufficiently qualified may be out of their depths in terms of the difficulties that you are dealing with. So oftentimes, for example, we were always told as clinical psychologists in training, be careful not to make everything psychological. And so somebody who's a counselor may see some signs of depression, but might not realize how, this can often be caused by diabetes or untreated blood sugar levels or thyroid difficulties or things like that. And so clinical psychologists have a relatively good understanding of the impact of one's physiology on your psychology and how what are kind of organic health problems, physiologically speaking, can impact you psychologically. Another risk is that the individual may be misinformed or not sufficiently informed on what is required to help with certain kinds of emotional and psychological difficulties. So they might be coming from a good place, but they don't perhaps realize the impact of, let's say, post-traumatic stress disorder, or even know how to identify it. It's not quite as simple as you might think. They also may give harmful advice, which can worsen the situation. So, for example, when it comes to traumatic experiences, what you don't want is to flood someone with memories of their traumas, which could result in a re-traumatization. And that could make the situation a lot worse for that person. So the registration categories that are listed, as I said, are governed and regulated by the Health Professions Council of South Africa. And this HPCSA, they have very strict ethical and professional rules by which the mental health professional registered with them has to abide by. And so you can be assured that that's the board exam. We have to know the rules in terms of what we can and can't do. And the rules are incredibly strict. And if you do not stick to these rules, your license can be taken away from you to practice. And so it's really important that such a body exists, because it protects the public. You can be reported as a professional, and you, as the public, there are also things that you can access via their website in terms of knowing what is and what isn't allowed in terms of from a clinical psychologist or counseling psychologist or so on. And so this is why it's a really important thing that such a body exists, and that these registration categories of mental health professionals are governed by this body. So this gets us to the topic of individuals not registered with the Health Professions Council of South Africa. And this is the part that colleagues and I often speak about. So, I'm very careful of not being too kind of precious about our profession, as in being kind of elitist or snobby because we've studied this, that, or other, but it really isn't about that. It is about accountability, and it is about the ways in which we're trained to know the risks of all sorts of things, being too familiar with clients, or bringing your experiences too much into the sessions, or essentially not knowing your own ego and how to actually allow the person to bring what they need to bring. So those not registered with the HPCSA are not held accountable to anyone or anybody, which means there are no rules for what they can and can't do. There's no body to report them to, as in, professional body. Should they be found to be practicing in ways that are harmful to a client or just unethical or unprofessional, there are no qualifications and experience requirements needed. Therefore, the public cannot be reassured of their competency and ethics. And so you just don't know what you're getting, essentially. If you you've got a car that you value and you want to look after, you're going to make sure you go to a qualified mechanic versus somebody who apparently does cars, but there's no proof that they have been properly trained. So that's kind of what I'm getting at here. And where do you find these people? So all mental health professionals need to be registered, as I said, with the Health Professions Council of South Africa. This is South Africa's only registration body for healthcare professionals that's, legislated by the government. So the HPCSA provides each mental health professional with a unique professional registration number. You can request this from the professional to verify with the HPCSA that they're indeed registered, under which registration category they are registered. And then with this, as I said, in order to qualify as a clinical psychologist, you have to have had all those degrees and, experience. And so then you are reassured that the person is adequately qualified, adequately experienced, that they also, the other thing, in order to stay registered with the HPCSA, you have to keep up with new learning developments. Every year, you need to acquire a certain amount of continued professional development points, and that you get through workshops and reading scientific articles, and then you can be assured that people are practicing according to what we know is current. You can also know then and be reassured that this person has to keep to the highest level of professionalism and ethics. And if they don't, their license will be taken away. Another benefit is that only these professionals are recognized for medical aids, so you can claim back from medical aids, or for example, in my practice, I claim directly to medical aids for clients. So the pros and cons of free and low-cost options. So I have to recognize that mental health services are very expensive and out of the reach of most South Africans, I would say, which is not ideal at all. That's just the way our country is set up, unfortunately, and a lot of countries. So your other options include subsidized services, such as NGOs and state services. Now, know that those in state services are completely qualified, but it is often a long, waiting period. With NGOs, so you get counselors or lay counselors, and they might not be as qualified. NGOs sometimes have psychologists, but again, you can check and ask what exactly somebody's qualification is. So it's a very viable option for many. They are, so in Cape Town, I think FAMSA would be nationwide. In Cape Town, there's also UCT as the Child Guidance Clinic. And those are often really, viable options still. The difficulty, though, is there is often a long waiting period. And so that can be hard for people. And also you probably don't have much choice in terms of who you see. So, if you can go the private route, you might see a psychologist, you just don't gel, and you go and try somebody else, which is really important that you have that kind of, interpersonal chemistry. So I want to also let the public know and caution them to be aware that many use terms to describe themselves when they are not HPCSA qualified individuals. So they call themselves just counselor, wellness counselor, play therapist, play practitioner, wellness healer, life coach. There are all sorts of terms. And so the terms used before, registered counselor, clinical psychologist, just the word psychologist, those are all protected terms that you can only use if you have those qualifications. These are not protected terms, and so people could call themselves just a healer in general, or I don't know, the possibilities are endless, I suppose. With regard to life coaches, so there are some who are accredited with certain bodies, and there are many who aren't. So life coaches are also a bit of a tricky area. Some have very limited training and operate often as psychologists, which is irresponsible and unethical. I don't think there's any other way I can actually say that. There is definitely a role for life coaches. Those are properly qualified and accredited, and they can often help individuals to achieve goals. Sorry, yes, I have it all. That was supposed to go first. But they are not qualified to help individuals understand their deepest struggles that often drive the inability to achieve the goals they consciously have for themselves. So people often will have a goal in terms of career or things like that, but the blocks, run deep and go back to childhood and that sort of thing. And life coaches aren't qualified to deal with that. If, however, you've resolved a lot of those things, but you just need guidance in terms of the practicals and how to, life coaches can be quite helpful with that. Okay, so this is the part that perhaps most of you have tuned in for. So do I have to see a Muslim mental health professional? So of course you don't have to, right? Many Muslims prefer to, though, I will say, as a Muslim clinical psychologist, I see many Muslim people, and they have come, most of them have come because they prefer a Muslim person. Many don't want to see a Muslim psychologist. They feel, they have concerns around that, and I'll speak about them in a bit. So the potential benefits, though, is that, having much of your lived experience understood on a deep level. So by lived experience, I mean knowing what it's like to be a Muslim, be a person of color, because in this country, by and large, to be Muslim means to be a person of color. And that's a very particular experience as well. Therapists, another benefit is that your therapist would understand what is important to you and why. So a lot of times, psychologists who aren't Muslim, aren't persons of color, often won't understand Islamic values, and the guidance often comes from a very white, Eurocentric Western lens, which is very I-centered, as opposed to we-centered, where we are mindful of our duties and roles as Muslims and our duties to the various people in our lives. And that those have to be honored. And so another benefit is that a therapist would respect what is important to you and why, as I said, so they both understand as well as respect that, and don't expect you to go against that, and find a way to help you with your difficulties. Let's say it's, family that expects too much of you financially or otherwise. And we can talk about what Allah expects from you as a Muslim and how to navigate that, given that your family isn't always respectful of, your time and your energy and your money or things like that. So the other benefits, and this is what I found a lot when listening to clients, and also what my Muslim colleagues have said, that clients have said, is that cultural or religious beliefs or observances are not inadvertently pathologized when they see a Muslim psychologist, whereas, there's often a view of Islam being relationships within amongst Muslims or within your family being codependent or enmeshed or things by mental health professionals who aren't Muslim. And with that's a kind of, by pathologizing, I mean making it a problem or problematic that one lives with your in-laws or that your child sleeps in your bed, when you know that that's not what you're there for and you don't think that's a problem, you're coming to deal with the actual difficulties. Another benefit is that the therapist will use and draw on one of your biggest resources to help you heal and make meaning of your difficulties, which is your faith. So we come to therapy when we are struggling, right? And probably the biggest resource we have when we are struggling is Allah, and is the way in which we as Muslims understand difficulty and pain and why we get given hardships and pain. And I really think that it's pretty impossible not to properly deal with difficulties if you're not actually able to make use of this worldview, this way of making meaning and understanding why things happen. But coming to some of the concerns about seeing a Muslim psychologist, it is very sad and unfortunate that in our community there are characteristics that are very unbecoming of being a Muslim, and one of that includes judgment and intolerance. And so understandably, Muslims often concerned that seeing a Muslim psychologist, they will actually be judged. They might want to speak about a termination that they had or an affair, and they are worried of being judged by this. And I don't mean to say that one has to sanction these things as a therapist and say it's all healthy, but it is about understanding, what brought that person to that point and where they are at now and how they can process that for themselves. I've actually had a client say to me, "What if I see you at a wedding?" This was pre-COVID though. I don't know, but I haven't been going to lots of weddings since COVID. I don't know the rest of you, but that was the concern. And it is more likely you'll see your therapist if you are Muslim and you see a Muslim psychologist in spaces that you might find yourself, but generally in our profession we will acknowledge you acknowledge us, but we absolutely have to hold confidentiality no matter what. We are, as I joke, often professional secret keepers. What if you know my family? That's also some concern. It's possible, but again, so a psychologist will tell you if there's too close a connection, if perhaps they are friends with a cousin of yours that you're close to or something like that. You absolutely have to disclose the conflict, or that there is some kind of conflict of interest, and refer the person on. That's part of that professionalism that we are bound by the Health Professions Council of South Africa. And so you don't have to be concerned about that. Sometimes people are concerned they come from a well-known family. And then again, what you sign up for as a psychologist, whether you're Muslim or not, is that you absolutely cannot disclose anything to anyone, and you absolutely have to know what your biases are and not allow that to interfere with therapy at all. And then, do you have to see a Muslim psychologist? Of course not. It's definitely your choice. I think a lot of Muslim people often do enjoy and benefit from seeing a Muslim psychologist, but the fit is really important, most of all, as I said. Do you guys get along, you and your therapist? Because I always tell new clients, it's important to see how you feel, to see, sometimes you meet someone and you hit it off, sometimes you meet someone and you don't, and it's exactly the same thing with therapy. And so I think that's the most important thing. Personally, I do think that somebody who understands and subscribes to your faith can be really helpful therapeutically as well. And then, so some of my final thoughts on on what I've been talking about, particularly the whole Muslim therapist thing, is I would say seek a Muslim mental health professional. If your Muslim identity is important to you, as in this is just how you think about things in the world, be mindful that not all mental health professionals with a Muslim name or Arabic name identifies as Muslim. Do not be afraid to ask for what you are needing. I would encourage you to feel comfortable with a therapist's worldviews. So ask what their religious and political views are. Therapists are very good at not answering questions, but once I understand why, I think they would disclose that, and you have every right to ask. I mean, I've had clients ask me all sorts of things, and I think it's important to know certain things. You do not have to compromise your values and beliefs to receive psychotherapy. A lot of people think of psychotherapy, therapy as un-Islamic, which is absolutely not true. Psychology has a very long history in Islam, much older than Western psychology. And so, but if you feel, for example, that you don't want to see a non-Muslim person or someone of the opposite sex, you want to kind of, even in your seeking of therapy, honor or do what you feel would be pleasing to Allah, then definitely do seek a Muslim person, seek someone of the same sex. And then lastly, don't be afraid of bringing your faith and spirituality into the room. This is your space. So people often say to me they didn't know they could talk about that. Or I think you must bring whatever you need into the room. The therapist has to work around you. They must use and work with what is meaningful to you. And it's your place and it's your space, and you need to feel comfortable. Let me just see if there's anything else. Okay, so there's nothing else. That's the last slide. I think there might be questions that I'll answer. These are my details. I'm a clinical psychologist. Fairuz Gaibie is my name. I'm based in Plumstead, Cape Town, and those are my contact details. And I will see if there are any questions and wait for those. Okay, here's a question. You've spoken about the pros and cons of seeing a Muslim mental health professional. Do you think it's also important for the patient to see someone of the same gender, especially for teenage patients? Yeah, I will often ask clients who I need, or maybe I need to refer a client on, or somebody wants to know, maybe somebody I know knows I'm a psychologist and says, do you know any psychologists who can help this person? I will often ask them what their preferences are in terms of all sorts of things. Do you want the person of color or not? Do you want a Muslim person or not? Do you want somebody who's not religious? So this is for all sorts of clients with sometimes they're not Muslim. Do you want someone, yeah, all of those things. I think that what's important is for the teenager, I would encourage you to ask their preferences. I would encourage you, I know we often look for them, the psychologist for our kids, but I would encourage you to send a couple of links and of websites and things like that, and ask your child to have a look at them. Often there's a picture of somebody who would they prefer to go to. They might not want to see a Muslim person, and I understand why you might want them to, but the right kind of therapist, even if they're not Muslim, will still be mindful of and be able to uphold certain things. I think that it's vital that the child, the teenager, gets to see the person, try them out, and if they don't like them, to try somebody else. Also, on this note, I don't think that our teens should be forced into therapy. I know some of them do need it, but they might be unwilling. I do think the right kind of therapist, because I've sat through many sessions with very upset teens, the right kind of person would be able to draw them out, but oftentimes, anyway, you actually need to work with the parents and the family as a whole. So, but I would encourage you to ask your child what they prefer. Is there another question? Yeah. Do you think a psychologist's personal thoughts or experiences in terms of Dean are brought upon the client? So it's a tough question because, so I was trained at UCT, and UCT, it's a good university, and I think the program is very good. It doesn't allow, there's not much place for religion and spirituality though. And anyway, so I was taught to your personal views it's really important to try not to bring it too much into the room and that sort of thing. I think it's impossible not to. I think you try, but invariably, the fact that I'm a woman, or that I'm Muslim, or that I'm the age that I am, or grew up where I did, impacts to a degree. You think is that the client? I don't think anything should be brought upon a client. I think you can see if it would be helpful for the client to use Dean in the therapy, but certainly not to if they don't want to. But I don't think anything should be brought upon a client, and that is just in general the thing. Okay, just see. I think that was done. Yeah, that was. I'm just checking. It looked like there was another question, but I don't think so. Just a few more minutes, see if there are any questions. I'm not sure if I'm being hosted at all tonight, so I don't know if I'll be told then we have to call it a day. I'm absolutely happy to answer more, but I just mean in terms of when we decide that we're done here, guys. I see something else. You're most welcome. It was a comment. Thank you for an informative session. Just checking on my phone. I think that we're done. I don't want to end prematurely, but I think this is it. Oh, somebody followed up on the question. I meant if Dean is important to the individual, but you maybe have opposing views, how is that managed? Okay, so let me just repeat the first question and give you the follow-up. Do you think a psychologist's personal thoughts or experiences in terms of Dean are brought upon a client? I mean, if Dean is important to the individual, but you maybe have opposing views, how is that managed? So I think the person, I hope I'm answering this correctly. I think you are asking, what if Dean's important to you, it's not actually to the therapist, or maybe even has opposing views, how is that managed? So a good therapist will absolutely respect what your views are and work with that and assist you according to your views, whether it's a Muslim person or not. That's how a good therapist should be. So a therapist who's Muslim or maybe doesn't have exactly the same views as you, they must manage their own stuff. They must go to their own therapy, must go to their clinical supervision and peer supervision groups. But unless your views are, so not around Dean, but unless your views are like problematic to you, unhealthy views of yourself or things like that, those have to be respected. Okay. Somebody just commented on the counseling app based in Cape Town and online for low cost counseling. That's correct. I always get confused. There's another place that has a similar name, but it isn't free. But yes, I think yes, there's the counseling hub as well. And I don't know what the waiting list is like, but it's definitely a viable option, and it's a very good resource as well. That is correct. Was there were a couple of questions. Now I'm going to wait a little bit longer. I haven't been told by anyone to stop, and I think it is until 1:15 anyway. Also, just to say, I don't know, a lot of people often don't know that this is an expensive thing. Yes, if you even have a hospital plan, though, with medical aids, if you qualify for certain diagnostic codes, depression being one of them, a clinical psychologist is able to apply for something called prescribed minimum benefits, and that is 15 outpatient sessions where you are able to see the clinical psychologist, and it unlocks that benefit, and it's the, per person on the medical aid, the main member as well as any dependents. And 15 sessions is a decent amount. You can really get somewhere with that. I have a lot of clients who would not be able to afford therapy otherwise, and I think it's a very useful feature. It gets renewed every year, so it's 15 per year. And as I said, even if you only have a hospital benefit, hospital plan, I mean, so do know that as well. And as I said, you get psychologists who will claim directly from the medical aid for you. Because I know with cash flow, it can be hard to pay the psychologist and then they claim. So that I think is a very viable option for a lot of people, just understandably don't have the money for these kinds of sessions. Just going to give it 2 more minutes and then I will log off. I see there's still 10 participants here. Maybe they just forgot they're still here. Are they still here? Perhaps, maybe, just because they do want to see what else might be said. So I will wait for a couple of more minutes. Please note that you can ask anonymously. Oh, yeah, there's one more. What is the charge per session for the private patient? So, psychologists can set their own fee. So yes, that means either R2 or 20,000 Rand a session, which sounds ridiculous, I know, but theoretically they can. It's generally around the rate that medical aids will pay. And so at the moment, it's around 1,100 Rand per session. And as I said, with the prescribed minimum benefits, that would be 15 sessions at that rate. So it's a decent amount of like funds that you are receiving in some ways. So that's the charge per session. Registered counselors are cheaper usually. Again, they can set their own rate. The medical aid rate is less. And so oftentimes it will be about what the medical aid rate is. And as I said, a lot of myself included, a lot of my colleagues and we claim directly from medical aids for clients. You are most welcome. You seem to thank you. Have fun. I think that might be it. So I'm going to end it off there. And yeah, I hope that helps. I hope it helps you for you to know different kinds of people out there and why you should be careful. And then also that you absolutely have a right to want your faith to be engaged with, if that is what you are needing within the therapeutic process. Okay, everyone, I'm going to end off there. Assalamu alaikum and have a good rest of your night.